As an interior designer, you may have to play the role of risk manager. We manage risk when we want the benefits that a material or product provides and are willing to accept some exposure to a potentially harmful substance to gain those benefits. In other words, the benefits outweigh the risk, and that exposure can be kept to safe levels. Risk-based assessment considers both hazard and exposure to determine risk. Exposure is how much, how long, and how often the substance can come in contact with people or the environment. The risk is the possibility of harm from exposure to a substance of concern under specific conditions. A risk-based approach evaluates the likelihood that the hazard will result in actual harm. It asks, what is the risk to people and the environment of using this material on a particular project? In what ways are we exposed to the chemical? Opinion A. Why should we avoid using innovative products that have positive impacts on our lives and interior spaces when we can reasonably limit exposure to a harmful ingredient? Opinion B. What amount of risk is reasonable? Click to see an example of the risk-based assessment. The degree of exposure to a substance of concern can occur through a combination of respiration, skin absorption, and ingestion. Risk-based assessment requires understanding the pathways in which people will interact with the hazardous material and how they can be exposed. Is it near them, on them, or in them? A material can be near occupants. Will it be in the space but without directly contacting occupants? It can be on them. Will it come into physical contact with occupants, but probably not be ingested? Or it can be in them. Are occupants likely to ingest the material by breathing or by swallowing? Valid risk-based assessments combine information about the dose or toxicity with the likelihood of exposure and duration to quantify the probability that an adverse effect will result. When determining toxicity or concentration levels, it is imperative to account for vulnerabilities such as body mass, age-specific factors, genetic variation, and pre-existing conditions. Generally speaking, people who are shorter, ectomorphic body types may experience stronger reactions to chemicals than taller, mesomorphic body types. This is why it's especially important to consider the needs of the actual occupants of the space as much as possible. Exposure level to a substance of concern can also vary over the life of the material. Some may be more harmful during construction or disposal. For example, caulk or spray foam insulation may pose more potential risk to the installer and less to a building occupant. It is important for a designer to be aware of potential risks and encourage contractors to follow guidelines and instructions. Advise construction crews to follow safety data sheets, SDSs, use protective equipment when installing products, train and certify workers, and ask for support from suppliers and manufacturers. Think about it. What if you had to evaluate an item that had these ingredients? Would you consider it to be safe? Select your answer, then click Submit. You realize that you did not understand the list of ingredients, which are from all natural blueberries. A list of ingredients with technical names doesn't mean much if you're not a chemist or materials scientist. Even substances like styrene, which may be a concern at high concentrations, is present in the blueberry in an extremely small, insignificant amount. It is impossible for someone without technical training to make informed choices about the health impacts of all the materials that could be used in an interior design project.